This morning we will be talking about why we sleep and how we sleep. And our focus this morning is going to be on sleep deprivation and sleepiness. That's the main thing we'll talk about. And somebody here is very interested in apnea and circadian rhythm. We will talk quite a lot about that and shift work. We have a lunch from 11:30 to 12:30. So just 1 hour. And then we'll spend our afternoon talking about insomnia. And specifically, I'm going to tell you about how to do cognitive behavior therapy for insomnia, which is actually considered the frontline recommended treatment for chronic insomnia. And it's something that's actually pretty easy to teach. So I will spend quite a lot of time on that. And we'll finish today talking about normal sleep, if there's such a thing, and how do you get it. So that's how we'll end today. Sleep apnea is a silent killer. And people don't think of it this way, but it is true. It is associated with all kinds of negative things, including car accidents. And if you can think of it, because it's associated with sleepiness, when you think about our people that are in the simulator, these people are actually out on the road. And some people have suggested that they're more dangerous than a drunk driver because their accidents tend to be more severe and more fatal than somebody who is intoxicated. So you're at an increased risk, sort of 2 to 7 times greater. And people with this disorder tend to, you stop breathing, there's no oxygen, and so your heart has to work harder. And over time, your heart will enlarge and all kinds of systems downstream, and your blood pressure, everything will change to try and compensate for this loss of oxygen. So there's many different sad disorders that happen. I know this won't mean a lot to you, but when I'm looking at it in a sleep study, typically in this area right here, what I would see are a beautiful rhythm, kind of like the circadian rhythm of breathing. When you think breathing is rhythmic. So we have belts on their stomach and on their chest, and we see beautiful breaths going up and down and up and down. And you see in this period, it just basically flatlines. And the reason why it's flatline is that this is the breathing and it is stopped. And just to orient you, each one of these segments right here is 1 second. So it's about 16 seconds or so that this person just stopped breathing. And what is important, and this is why, and people say, well, why are you sleep deprived? Because you stop breathing, and then see how it gets all fuzzy here? This is the brain. And the brain has to wake up in order to resuscitate you. And that's what the mechanism is. Now, this person may be so sleep deprived that they will be unaware of this arousal. They just can't. It doesn't register to them, so it's only the brain waking up. But the brain waking up means that has implications for what stages, and so you don't get into deeper stages of sleep, and there's constant arousals. For us to even count this is the apnea-hypopnea index. Hypopneas are just that it might not be flatlined, it might be just sort of a drop of about 50% in the breathing, but functionally it's the same. We don't typically diagnose it until you have at least 15 of these events per hour. So you think about, 15 times an hour, you stop breathing for at least 10 seconds, and some people can be like a minute that they're not breathing. And at that point, we typically will treat it. We will treat it if it's less than that, if you also have excessive daytime sleepiness. So even if you're not waking up. And then another factor in is that usually you desaturate quite a bit. This is a very interesting disorder because some people will say, it's very common for somebody with sleep apnea to say, I don't know why I'm here. I don't have a sleep problem. I put my head down on the pillow and I don't wake up, so I'm a great sleeper, right? But it is associated with all of these severe medical conditions, and the driving is particularly scary. There's a high prevalence in clinical populations. It's very costly. Untreated apnea is very costly, as you can imagine, because it causes all these other problems. And most importantly, the one thing that sometimes people with apnea will complain about is how they feel during the day. So they don't feel good during the day. They are sluggish during the day. They're quite tired, and they're cognitively, they're just not as focused as they used to be, and it's very difficult for them, and their quality of life suffers. Okay, so what can you do about it? Well, here is a useful thing, and here's a website that you can get it from as well, if you want, and you can use it for clinical purposes for free. First, it's called the stop bang, but I'm going to start with the stop, mainly because the bang, there's some evidence that it's actually led to some underdiagnoses in some groups. So let's start with the stop, S-T-O-P. The S is for snore. But it's not just snoring. So it would be loud snoring. So can I hear it through a closed door? Is it the volume of a conversation? And so if it's that audible, then it's significant snoring. But you can have snoring and nothing else, and you probably don't have apnea. Okay? So it's really, you have to have two or more. The T in STOP is tired, which I would actually say sleepy. So do you fall asleep during the day? And if the answer is yes, then now we have 2, and 2 is suggestive that they should be referred for a sleep study just to make sure. 3 is observed apneas. Now everyone will say to me, how would you know if somebody stopped breathing beside you? But it's attention grabbing for some reason. There's something about it that is very strange. And P is for high blood pressure. It's the first system that gets affected. So suddenly somebody develops high blood pressure and they're a snorer, there's 2 and they should be referred to rule it out. Now here's the bang. And I should say that the bang part of the stop bang has been validated. It's just that we know that there tends to be this idea that, oh, apnea is for people that are overweight. That's not true. I think it's in about 40% of cases or something like that. So if you have a BMI, if you're in the overweight range, if you are older than 50 years old, again, so younger adults, and certainly kids can have it too, tend not to get referred. If you have a neck size greater than 15 inches, and if you're a male. Now there's a documented problem that women, especially very slight little old women, they're not getting referred for apnea studies, and the chances of them having apnea are increased. So, so I think the stop bang is good, but keep in mind that this doesn't mean that this is your prototypical patient, that you can, this just means it increases your risk.